It is the inflammation of the paranasal ear sinuses, namely the maxillary, ethmoid, frontal, and sphenoid. It can be acute, subacute, chronic, or recurrent acute sinusitis based on the duration of the illness. Being an extension of the upper respiratory tract, the organisms causing sinusitis are very similar to that of URI. Typically, sinusitis starts as an URI, but later on, superinfection begins with single or multiple bacterial invasion. There are few conditions which predispose an individual to development of sinusitis, and those are viral upper respiratory tract infection, nasal polyp, nasal foreign body, adenoid hypertrophy, cystic fibrosis, allergic rhinitis, ciliary dyskinesia, prolonged nasogastric tube, and immunodeficiency states. Sinusitis is to be suspected in a child where the URI symptoms persist for more than 7 to 10 days without clinical improvement, along with few other features like persistent nasal discharge, anosmia, that is inability to perceive the smell, headache, maxillary or facial pain, otitis media, irritability, and low-grade intermittent fever spikes. However, high-grade fever with purulent nasal discharge or facial pain can indicate acute severe infection of sinusitis. There are few clinical signs on examination of a child with sinusitis. On inspection, the nasal mucosa might be congested. A very strong pointer is presence of purulent discharge in the middle meatus of the nasal cavity. There can be periorbital puffiness due to ethmoid sinusitis. Tenderness over the maxillary or frontal sinuses can be present in case of acute sinusitis, and it can be a good diagnostic pointer. In few patients, there can be effusions or fluid in the middle ear cavity. The complications of acute sinusitis are divided into three categories. Number one, complications related to eyes, that is orbital complications. Intracranial complications that are related to in and around the brain. And systemic complications, that is the whole body is involved. The orbital complications of cellulitis include preseptal cellulitis, orbital cellulitis, subperiosteal abscess, and orbital abscess. The intracranial complications of sinusitis can be cavernous sinus thrombosis, meningitis, epidural abscess, subdural abscess, brain abscess, blindness, and Pott's puffy tumor. The systemic complications include toxic shock syndrome and systemic sepsis. The diagnosis of acute sinusitis is essentially a clinical one, and that's why routine laboratory investigations or imagings are not essential. However, in some conditions, the lab work or imagings are necessary, like in a complicated case of sinusitis, in medically refractory cases, or to diagnose some underlying predisposing factors like cystic fibrosis, ciliary dyskinesia, allergic rhinitis, or immunodeficiency. X-ray of the paranasal sinuses, if done, it can show abnormality in about 80% of the acute sinusitis cases. It can reveal complete opacification of the sinuses, air fluid level within the sinus, and a mucosal thickening more than 4 mm. CT scan or MRI is reserved for those cases which are refractory to medical therapy, or if chronic or recurrent sinusitis is being suspected, or if any surgical intervention is being planned. If a child is diagnosed or suspected to have sinusitis, the treatment consists of antibiotics and supportive management. In uncomplicated acute sinusitis, the first line of therapy includes the penicillin group of antibiotics. However, in complicated sinusitis like high-grade fever spikes, orbital edema, visual disturbances, severe headache, altered mental status, or meningeal signs positive cases, intravenous antibiotics has to be started on urgent basis and the necessary investigations are to be done as per requirements. In medically resistant cases, the surgical options are to be considered like sinus drainage, antrostomy, or functional endoscopic sinus surgery, which is the gold standard of management. As a physician, our responsibility is to diagnose the condition as soon as possible with high index of suspicion, along with the prompt management with intravenous or oral antibiotics, and to provide the adequate supportive care.